Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I have a couple of quick announcements for you before we bring on our guest for today. We have our December summit. The tickets are available. Make sure you use the QR code or the link in the chat to get your tickets for this amazing event. We also have our July symposium coming up at the end of the month. It's going to be a really great session, so make sure that you save the date and grab those tickets as well. And lastly, we have our Women's Health Tech Challenge applications officially open. The deadline is September 3rd, so make sure that you get your application submitted so that you can participate. And with that, we'd like to formally bring on our guest for today, Fariha Ahsan, who is the Associate Director of Consumer and Population Health Informatics at Memorial Sloan Kettering. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Fariha during our conversation, please use the Q&A or the chat, and I will make sure that we get to it. So with that, we'd like to formally bring you on, Fariha. Thanks so much for being here today.
Thank you so much for having me, Nina, and hello to everybody. Happy Wednesday. That feels like a Friday.
Yes, definitely. The best Wednesday that there is. Amazing. Well, would love to, kickstart the conversation. If you could just tell us a little bit more about your career path. What inspired you to pursue a career in consumer and population health? A little bit more about that journey that has led you here.
Yeah, no, well, thank you for opening that up, Nina. And maybe I'll start with sort of my personal and professional journey to this as well. So I am an immigrant. I moved to America at the age of 17 on a scholarship to Cornell University. And it was while I was at Cornell, I was studying health policy, and I was standing in line to get my blood drawn at like the student health center. And I realized I couldn't, for the life of me, understand my own insurance plan. Studying health policy. And so just realized that there was this gap, and this was many years ago. So I created this website that was dedicated to sort of increasing insurance literacy. I worked on that for about 7 years, and its end product, this was around the same time that elements of the ACA had been released too. So this was really focused on helping immigrant mothers navigate both the prenatal and postpartum care that they were provided through elements of the ACA at that time. During this time, I also worked at NYU. I went back to school for my graduate degrees, which I did in public administration, finance, and then in informatics. At NYU, I was in business analytics for a while, understanding sort of patient flow and patient access flow. Moved over to New York Presbyterian, where I was part of the Weill Cornell operations team. And over there, I learned so much around patient flow and patient access, and really the critical element, sort of seeing at each of these institutions is that they were having their Epic transitions, and they were preparing for Epic launches. And what we were realizing was there was so much opportunity around understanding how do we define different metrics when when different systems, if you're in an outpatient clinic, you're using a different EMR, and you're in an inpatient setting, you're using a different EMR. When you have different staff, different practices, you'll realize that people often start defining the same thing as different things. Like, what is truly wheels in, right, in a room? What is truly like OR turnaround time? And so I spent a number of years in my career doing a lot of metric standardization in operations. I know I was part of the team that helped open up the David H. Koch Ambulatory Care Center on 68th Street, and helped design the Cohen Women's Hospital. During this time, I finished my degree in informatics, was really interested in the intersections and the continued intersections of technology and healthcare, and specifically how we could use newer technology and data-informed decision-making to improve access to care. And so I joined the innovations team at New York Presbyterian at that time, and we were the innovation digital health team, and we were quite small when I joined, and then it grew to be a much larger team. This is pre-pandemic. And so I always joke, like, we were doing like really cutesy things with telehealth, and then the pandemic hit, and like overnight, we stood up a remote patient monitoring program for patients with hypoxia to be discharged safely home. We scaled telehealth, from being 4% of all visits in the hospital systems to being 80% of visits. and also grew our team very rapidly. And so it was a really difficult time, of course, and also it was a lot of rapid learning. And through that rapid learning, just being in a position of like leadership, I realized one thing we were continuing to see, coming back to my interest around metrics, was that there were so many disparities. We didn't even have at that time, full understanding of what our patient demographics were. And then the little that we did understand, we saw that there were really great disparities in those who were being able to access, stay compliant to their discharge plans for remote monitoring. And so I started working with Greater New York Health Association on sort of what were going to be some of the standards of like digital equity that we were going to embody for all of our tele and remote programs. And around that time, I was recruited into the role that I was in previous to my current role at Mount Sinai, where I oversaw an innovation hub. I spent about 3 years there, and that was also a really great experience of, cultivating both community entrepreneurs as well as establishing the healthcare system's digital equity and accessibility workflows. And from there, now I'm over at Memorial Sloan Kettering, where this opportunity opened up. Memorial Sloan Kettering is basically at the brink of also rolling over and adopting Epic. And, as part of that, we're looking at a lot of the workflows of new patient entry and new patient access to the systems. On a personal note, I am a survivor. So back when I was working on my startup, I was diagnosed with liver cancer. I was still very early stage, and I was a patient at Memorial Sloan Kettering. So it's a place that holds a lot of it's a very special place to me, and I'm very grateful to the care that I received there. But knowing how hard, even as a very tech literate, health literate individual, it was to navigate that care, my hope is that in my new role, I can do a lot of that work around how do we make that care transition easier. So that's sort of a little bit about my journey and my career journey. I have been at Memorial Sloan Kettering for about 3.5 months now, so it is still fairly learning the land, and it is a terrific organization, and I'm really enjoying my time here, so I'm really grateful for that, and also really excited for sort of what's to come as well.
What a journey. That is incredible. I mean, the startup that you had implemented when you were in school, I think is so needed, especially when it comes to the literacy aspect for insurance, but I think just health more broadly. And I really like what you were talking about when it comes to like metrics specifically for technology. I thought that was really interesting. Kind of to your point, you just did so much work around like consolidating, standardizing metrics almost as like one shared language. And now to do it for tech, I mean, I'm so curious, do you kind of feel like there is more of like a standardization in metrics specifically for tech use?
Yeah, I think that's a really good question. I think a lot of like metric standardization, especially from like a more, citywide, national, federal levels, a lot of it comes from regulations. So
Right.
metrics that have been standardized across hospitals usually are those that, CMS is requiring, insurances are requiring, or the Joint Commission has required. With technology, because telehealth, I mean, we finally do have some regulations in place, but there continues to be, right, I think a great opportunity and continue to grow and standardize and implement and, actually create more of I'd say like a revenue opportunity around implementing different technologies. I think there still is an opportunity. So I think we're not where we were 3 years ago, but there's still a lot more opportunity to come.
Totally. I love that. Yeah, definitely a lot of opportunity. And I think on that note too, I mean, a lot of the work that you've done is you've really kind of been at the forefront of a lot of change, whether it's adopting a new system or transitions, all of that type of stuff. I'm so curious, are there any specific obstacles or challenges that you've faced as you've just had to essentially navigate either a new ecosystem or a evolving ecosystem, and any strategies on how you overcame it so that we can learn on how to overcome it for our own, professional careers?
No, thank you, Nina. I think that's such a good question because I remember early in my career, I was very much around a lot of people, and these people continue to be mentors, honestly, in my journey too. Um, and they really helped me grow my career, but they had been in those, like they had sort of grown in a sort of step ladder way in, you know, those teams and in those institutions for many years. So
Mhm.
something that I've found interesting is I actually have sort of moved from different healthcare systems across different healthcare systems and across different teams, and also seen the epic transition a number of times now at these different institutions. And I'll say like change, and obviously we've all sort of experienced, right, the change in healthcare through the pandemic as well. And change is hard, right? And while it's happening, it's very hard, and it comes out of like, what does this mean for me, and how
Mhm.
will this impact my career? And something that's been really helpful to sort of continue to keep in mind is for some people, you know, they will find their career in one team at one institution and grow laterally there, and that is amazing for them and perfect for them. And I hope that, right, for whoever it's right for, that's great. I don't think that's the same journey for the majority of people, just because there's limited positions as you continue to grow up in your career. And also as you continue to explore what it is that really fulfills you and what's the niche that's speaking to you. And so, sort of in every position I've been in, I've sort of asked myself, right, like, what am I learning? Am I still learning something here? What is
Mhm.
it that I'm picking up, right, from change management? And so from all this change management. And so even for the teams that I've managed, obviously change brings about it a lot of anxiety, right? And unease. And so I always remind them, like, you may be in this like team forever and you may not, and that is okay too. But while
Mhm.
you're in it, try to think about what you're learning right now, right? Even for yourselves, like make a bullet point list, right? Try to track, like, what is it that I've sort of reflected on over the last week, month, that is a takeaway. And it's great to have hard metrics, and it's also great to reflect on some of those soft skills, right? Like I've
Mhm.
managed understanding, right, from new patient forums, and you know, people have to intake. Sorry, this is just top of mind because it was in the meeting I was in right
No.
before this. But like, I know there's been this new patient forum that's existed for 2 decades, and now we're switching it over to Epic, and I've convinced stakeholders, right, that this is the right move to make. And
Mhm.
that in itself is, those are impressive feats, and those are impressive things to be able to reflect on. So I just tell people, like, to sort of think about what it is that they're learning. And yes, change is hard, but also how are we going to reflect on that, right? Like, you,
Absolutely.
life is changing constantly, so
Definitely.
you could use it to your benefit.
I love that mindset. I think that's so powerful. And it really always is kind of just centered on growth and opportunity, which I think is always, such a good outlook to have as you, to your point, advance in your career and continue to redefine or kind of validate what serves you and the purpose that you have. So thank you for that, Fariha. That was very inspirational too.
It's hard when you're in it, right? And that's not
Yeah.
to take away how hard it is when you're in it. But like, no situation has been forever. So
Mhm.
comfort
Very
yourself
true.
with that if you're ever in a hard situation. But even when they're good situations, right, in the healthcare landscape, leadership are always changing, especially when you
Right.
have epic transitions, especially when you have pandemics, when regulations are changing, reimbursement is changing, the way healthcare systems are structured and are changing. And so, you know, I think it's good to be comfortable and happy where you are, and it's also good to be continuing to think about, like, what am I learning actively on a regular basis.
100%. And you actually bring up a really interesting point when you were talking about like leadership changes and some of those things that can also happen. I would imagine in your role, there's probably a lot of partnerships, collaborations, things where that it's really a cross-functional team to execute. For you, I think from a leadership perspective, but also just, cross collaboration, what is it that makes like a partnership or collaboration effective? Especially I think in the context of the health informatics and kind of just the space that you're in. I'm so curious on like how you navigate some of those things.
Yeah, you know, and I'll say, like, it's something I have also continued to learn, right, around, like, through my career too. And I'll say this because when I was sort of earlier in my leadership roles, um, I used to like wonder, right, balance sort of what I thought was niceness coming into a meeting. And I would say this just to be like completely transparent as a woman and as a woman of color and as an immigrant, because oftentimes, right, there's this idea that you have to sort of be in these meetings and be nice and be polite, which do all of those things, but also, I think establish at the beginning of those conversations who is who, what is each person's role, right? What are our expectations? Oftentimes I was like brought into meetings and there was no clarity of like who was doing what, right? You have 6 senior leaders sitting in a Zoom meeting or sitting around a table, and it's like, well, who's doing the sign off? Who's doing the decision making? And also, what are we actually trying to make a decision around? And like, I'm grateful that through my career, I've had the support of like the people who I've reported to and the leaders I've reported to who've encouraged me to continue to step into that role. I'll say in like informatics, that's been a really valuable skill set, because I start off every meeting by establishing those rules, right? And making sure we're all on the same page, because that's what's going to make the conversation effective. And of course, it's nice to have the like, the niceties, but oftentimes when you're in 30-minute back-to-back meetings, on Zoom, or you're in 45 minutes, like switching context so quickly, it's important to establish really what it is you're bringing that together everyone's time for. And that, right, being clear on what it is that everyone's role is and where the sign-offs are, who's doing what, how are people going to be involved, how frequently are we going to be setting up those meetings, and so who's on the work group, in the details and the nuances, and who are we reporting back to. I think establishing those boundaries very early on in every conversation and every sort of group is so important, because that will also set up those structures for mutual respect then, right? Everyone knows what to expect from you, and you know what to expect from them. And then as things need to change, they will change, but you've already sort of laid down the groundwork. So I guess it's like a little bit of project management, but I'll say like it's important to stay on top of that.
100%. Yeah, and I think just like being able to kind of go in with and have that clarity and that transparency, I think only just makes things that much more productive. So very, very good skill set. Thank you for sharing that. I really wanted to ask you, one of the things it seems like has been like a throughput through your career from your startup to where you are right now. And you kind of mentioned it a couple of times, is really centered around equity, which I think is so needed and so powerful for you. And this I know can be maybe a big question, but I'll ask it anyways. When you think about initiatives or policies, especially now, especially kind of as we are centered more towards technology and as like the landscape keeps shifting, are there any particular, policies, initiatives, things where you feel like are really important or just should be prioritized for promoting? And I know this is Women's Health Tech Wednesday, so I'll say gender equity, but I think equity more broadly in healthcare.
Yeah, that's such a good question. And I'll reflect on 2 things, right? One is I recently moved out to Connecticut, and I'm in a town in Connecticut which has a sizable population. And it's like my internet connectivity. I switched internet providers 4 times.
Oh my
God. Finally, the 5th time we got the fiber optic broadband installed in our house, because I work from home at least 3 to 4 days a week, and I go into work one day, and I was thinking about this around internet connectivity, and I'm I've done so much work around digital connectivity, and it's still so hard in so many towns and so many places around the country. But also even in New York, right? You go upstate New York, you go 30 minutes up from Westchester, and internet connectivity is hard. And it largely impacts women, because for a lot of hybrid work right now, a lot of women prefer that. And so I just found that very interesting, so especially around digital connectivity. And then I know from a federal level, there have been a lot of different advancements and a lot of different funding streams put into connectivity and sort of broadening 5G and broadening that piece. And there still seems to be such a gap, which is something I just experienced over the last 2 months, where I was oh my God, what am I going to do? How will I continue to work from home if I can't establish a stable internet connection? Yeah. So that's something interesting. And I think right, like when you are in sort of heavily urban areas, you don't realize how much people are being impacted by it until I guess you take a step away. And it continues to be an area, right, where there still is so much opportunity. And I'm glad that there's been a lot more federal focus on that. I'll say that with the caveat that I'm actually so impressed because internationally, if you go to many countries that are considered sort of to be not as advanced from a technical standpoint, their connectivity is and the solutions that they have out are pretty incredible, right? You can go to like rural Bangladesh and even across rural Pakistan and India, like there's a lot out there, that people have established. Like you have little USB devices and you're able to plug that into your laptop and literally connect in rural settings. So I'm excited to see some of that sort of advancement actually be reflected here. And I'm hoping that some of that federal funding will allow for like greater connectivity across America too. And then I'll say like the other one, it continues to be around devices, right? Like we continue to assume that everyone has some form of like smartphone connection, especially when it comes to like digital health and when it comes to digital connectivity for telehealth, for appointment making. And so one of the exciting projects we had worked on while I was at Mount Sinai and something we continue to look at here at Memorial Sloan Kettering is how can we have more community establishments and community partnerships to broaden that access, right, to digital tools.
I love that.
So like public libraries being able to, right, partner with public libraries so that people at public libraries can be able to schedule appointments or have a private hub to do a telehealth visit. And so I think sort of creating more of those spaces where those connections can happen.
That's a great idea. That's incredible. And it definitely seems like there's, to your point, a lot of change, a lot of good opportunity. So it seems like it's just pretty exciting to be on the forefront of it all.
Yeah, I think one thing I'll add is that a lot of my jobs, right, that I've sort of held and sat in did not exist 5 years before I was in that job, or did not even exist before my job. And so I'll say, especially in this space, right, having that level of comfort of like defining what it is you're trying to do and accomplish, and also being open to explore is good, right? Like I think it's okay to be sort of at that level of comfort and also level of unease, right? It's like, what is next? I don't 100% know either, and that's okay. So I say that because, right, like it's cool because then you get to explore some things that haven't been created before.
Very much so. And I think on that note, I realize it's like we're so close to our time together, which is crazy because there's so many more questions I could ask you. But one of my favorite questions to ask, which I think you created such a great segue for it as well, is, what advice would you give either to someone that's maybe just starting out in their career or looking to transition into a career in informatics? Any just career advice that you have, anything that maybe a mentor told you or just something that you've discovered that you want to, share with us?
Yeah. I think that's a really good question. I mean, I think there's so much I could say here. I guess one thing that I found really effective, right, in this age of like, how do you balance everything, or how do you multitask and how do you optimize time? And I learned this a while back, but it's really like, instead of thinking about things as balance, I think of things as like blocking off my time, right? I think of like, okay, in the morning, like my block is around like making sure everything's ready, right? And like food is prepped and breakfast is ready, my toddler's out, and I have everything ready, my coffee ready. And then like the next block is, right, like either some days I have like meetings or I need to commute in and, then I'm catching up on emails. And so I try to like block my times off accordingly. And that doesn't necessarily mean putting physical blocks on my calendar, but I think mentally just having those blocks,
yeah,
it helps from like burnout. And I say that because I think that there's such fine lines between like the boundaries we set, especially with hybrid models in place, with something always happening, networking events. And so I think like blocking off days and weeks in terms of what makes best sense so that you're optimizing your time in places that fulfill you, in places where you have to be, right, your own commitments. And then obviously in terms of meeting work requirements. So yeah, that's sort of my encouragement of like, make sure you don't burn out.
No, that's so helpful. And yeah, I definitely feel like almost having a structure to like allows you to kind of give yourself permission almost to be like, you know what, I dedicated this time. I'm gonna, do this task. So I really love that. Thank you so much for taking the time to chat with us today. What an enlightening conversation. I so appreciate it.
Thank you, Nina. It was wonderful talking with you. Have a good one.
Thanks, Fariha. Make sure you join us next time for our next Women's Health Tech Wednesdays. I just wanted to give a couple of quick shout outs. Wanted to shout out our sponsors for sponsoring the conversation. Also wanted to shout out our guests for such an incredible discussion. I wish everyone has a happy and safe 4th of July. We will see you all next week. Bye, everyone.